I'm Carol Ramphone. I'm 45 years old. I've had 2 brain aneurysms and a ruptured disc. So I'm lucky to be here. I would describe myself as being outgoing. I'm an internal optimist. I try to always think positively, and I'm a speech-language pathologist by trade. Some of the things that I really like to do is spend time with my family, spend time with my kids and my parents and my husband. Oh, I enjoy spending time with my animals. I've got 2 dogs, 3 cats, 2 bunnies. Favorite pastimes are probably just spending time outdoors, going for walks, going on bike rides. I like to do a little bit of reading at times, spend time on the computer. About a month before I had the aneurysm, I had woke up in the morning and I had woke up with an amazing head pain, and I kept saying to my husband, I think I'm having a stroke. Like, I could feel my brain is squeezing. I feel like I'm having a stroke. They did a regular CAT scan and they came back and said it was merely a migraine. They didn't see anything in the CAT scan, and so let me go home, and that was it. And 1 month, almost to the day of having that problem, a similar thing. I was at work first, and a couple people had told me that I was complaining at times. I had a bit of a pain in my head. And then I came home, and Ken said he heard me scream again, my head, my head, my head. And then the next thing you know, he told me that I went unresponsive, and he started CPR. My nephew called 911, and he had no pulse for a few seconds, and then the EMT arrived and they brought me to the hospital, and that's when they saw the blood going through my brain, and then they transported me to St. Petersburg to see Dr. Joby. The pain was so severe, like I said, it was causing me to vomit. So it just gives you an idea how bad it was.
Upon arrival at the hospital, when I initially met her, she was unresponsive and was probably even unaware of who was taking care of her.
I sort of remember waking up in the hospital and looking around me, and I recognized everybody except this one person, and I guess that was Dr. Joby, and he was smiling.
So her initial images, the CT scan, had shown hemorrhage over the surface of the brain. She also had enlarged fluid-filled spaces in the brain, which required emergency placement of a small tube to be a pressure relief valve out of the head. So we did that almost immediately upon arrival.
I remember him telling me that I had a fairly big bleed.
It turned out it was a basilar tip aneurysm, which is an aneurysm just about as close to the center of the brain from all directions that you can be.
I had a second aneurysm as well, and it was closer to the front of my brain, so he had to move the nerve to my eye to get at the second aneurysm. And because of that, my eye was paralyzed for a period of time.
The next thing we did, we just got her on over to the operating room at Northside Hospital, and immediately prepared to go under surgery. From there, I proceeded to clip the aneurysm.
It was pretty scary. My husband had to tell my 16-year-old that there's a good chance I wasn't going to make it.
The surgery went as well as you could hope. Basically, to get both of them secured and to know that she wouldn't have any further risk of rupturing from either one of those aneurysms. And then from there on out, it was bringing her back to the intensive care unit and then to watch her closely on a day-by-day basis.
When the nerves started coming back, I started having like double vision. I had that for probably a good 3 to 4 weeks after that. And he kept assuring me that it would improve, like that it would go away. And so I had to put my faith in him, and he was completely right. It did go away, which I couldn't thank him enough for.
It was 3 months out that we saw her, and we do repeat imaging to make sure that there's no evidence of recurrent aneurysm or any way these things could grow back. Once we confirmed that, I was able to see her acting as a normal human being and started to ask about when she could get back to work and such, that we knew that she was doing well.
It was pretty tough. Yeah, it was pretty tough, but I got it through. Since the surgery and since the vision and everything has returned, physically, motorically, I was good. I mean, I didn't have any signs of any kind of neurological impairment with my hands, my feet, or anything. I mean, I was amazing. In terms of Dr. Joby, like, I truly owe him my life. I mean, there's no greater gift he could have ever gave me and my family and my kids and my parents. I mean, if it wasn't for him, I wouldn't be sitting here. He's been my angel, like, truthfully. I don't know what I would have done without him.